So coming to the digestion and absorption, we will deal it together. So we will read about a particular substance and what is the byproduct, how it is taken up in the GAT. So everything we will cover together. So first starting with the carbohydrates. Carbohydrates, what they do is they are digested by salivary amylase, pancreatic amylase, and they have another enzymes from the intestine which is maltase, sucrase, lactase. So these are all the enzymes which is going to act on the carbohydrates. So once they act on the carbohydrates, they will produce the end products which is glucose, galactose and fructose. So now we have to remember which is the transporter for each of this substance. So coming to glucose and galactose, they go through one same transporter, which is nothing but our SGLT. What is this transporter? It is sodium glucose co-transporter, and the type here is type 1. Sodium glucose, what it is transporting both of it, that's why it is called a sodium glucose co-transporter, and the type is 1. This is an important MCQ. So what fructose is transported? Fructose is transported through facilitated diffusion through an uniport which is called as GLUT5. The number is also important. GLUT5 is the one which is bringing the fructose. This is from the apical side, it is being absorbed. It has to be transported from the basolateral side to the blood. Suppose blood column is like here, it has to be transported through one transporter. That transporter is nothing but GLUT2. So all these three transporters, SGLT1, GLUT5 and GLUT2, all of them are important. This SGLT1 has one more clinical significance on the mechanism of oral rehydration solution. This oral rehydration solution, whatever we use, they have sodium and glucose. Usually both of them are combined and given in a ORS. What is the reason? Because they are efficient. When both are available, they efficiently activate this SGLT. So both the electrolyte imbalance as well as the glucose intake can be made simultaneously in case of severe vomiting or diarrhea where the ORS is given. So coming to the reabsorption of fat. Fat, it is mainly activated by the pancreatic lipase. Even though there is a gastric lipase, but still fat is mainly digested by the pancreatic lipase. And there is one more substance which helps in fat digestion, which is bile. Bile will cause emulsification of fat. Emulsification is like making it soft to digest. Then usually most of the fat transport happens through micelle formation. Micelle formation is there and they will be transporting this micelles into the cell. But recently they have identified one more transporter which is called as fat transporter. It is easy to remember it since it is transporting, but the number we have to remember, it is fat transporter 4. This is the recent transporter which is identified, which is bringing in the fat to the cell inside the cells of the GAT. Then coming to the protein digestion. Protein, they are activated by pepsin from the gastric acid, then trypsin from the pancreas and peptidase from the intestine, and they will be converted into their micromolecules, that is amino acids. This amino acids along with the these amino acids are usually reabsorbed with the sodium. Maximally they are reabsorbed with the sodium through the help of sodium amino acid co-transporter. This is nothing but a sodium amino acid co-transporter. It transports both of the substances. Then there is one more transporter which transports hydrogen and the amino acid. This transporter is specifically named as PEPT1. This is named as PEPT1 transporter. So this is also important. Then coming to the summary of all the reabsorptions. This is asked in MCQ, so thus we have to remember a few points. Most of the substances, like almost all of the substances, are maximally reabsorbed in the duodenum. So that will not be a question. Obviously, exceptions are the questions. So what is the exception? The exception here is the reabsorption of water molecules is maximum in the jejunum, whereas the reabsorption of vitamin B12 or bile, both vitamin B12, that is also called as cobalamin, and bile, both of it happens in the ileum. That's why we read whenever vitamin B12 is intrinsic factor is deficient, the vitamin B12 is bound with it. Whenever it is deficient, what will happen? Even the vitamin B12 reabsorption will be hampered, because both this has to reach the ileum for the vitamin B12 to be reabsorbed. So these are the substances which are reabsorbed maximally in the ileum, vitamin B12 as well as bile. So this brings us to the end of gastrointestinal system. Thank you for watching.